Hi guys, welcome. I am excited to talk to you today about the study by Sorensen and Associates from 2020. It's about children's fear of needle injections, and it's a qualitative study of training sessions for children with I don't know how to say it, but it's like rheumatoid diseases before arthritis, before home administration. So, as a qualitative study that uses the ethnographic approach, the researchers focused on social behaviors, communication rules, and cultural norms, specifically in the context of a pediatric injection training environment. The study was done in a natural, non-experimental setting using video recordings to capture what really happens during these sessions. The researchers wanted to observe individual actions within a certain population to understand their experiences and examine the connection between education and emotional response. So let's talk about the design and approach. The type of study design, it's a qualitative study which focuses on understanding and or describing a phenomenon through non-numerical data. So in this case, it was interviews and experiences. It's an ethnographic approach because researchers sought to observe individual actions within a certain population, understand individual experiences, and the connection between education and emotional response. It's an exploratory design in nature because it aims to understand a relatively under-researched topic, which is how children express their fear and pain during injection training specifically. And it is descriptive as well because it provides a detailed picture of how these training sessions unfold and how communication happens between children, nurses, and patient parents. On the screen, I have listed kind of direct quotes from the study, but I'll talk about the research problem in my own words. So, the main issue being studied is needle anxiety in children who are prescribed home injection therapy for rheumatic disease. Sorry, I am really struggling with that word. This is important because fear of needles can lead to refusing medication, which can interfere with treatment. The way nurses manage children's fears and pain during the initial training sessions may affect how future injections are handled at home. This study addresses a gap in understanding of how children express fear during training and how adult communication really impacts their emotional response. Again, on the screen, you're going to see listed the study's aims and research questions explicitly listed from the text. The aim of this study is to explore how children express fear and pain during training sessions for subcutaneous injections, how nurses and parents' communication affects children's emotional responses as well. And these research questions guide the study in examining real-time emotional reactions to the social dynamics involved within the patient's interactions. So you can see the questions here. If I were to read through everything, we'd be here forever. So I'll let you read over that really quick. This study used an ethnographic qualitative methodology, collecting data through video observation of 9 individuals during their individual training sessions, short interviews afterwards. The research observer was present during the whole session and took field notes to contextualize the interaction. The nurses were then asked later how the child's behavior differed with the researcher present. The participants included 8 children, ages 5 to 15, 11 parents, and 7 nurses. Purposeful sampling was used, meaning participants were selected based on specific criteria like diagnosis, age, and geographical location. And I did say that there were 9 children, but only 8 were taken because one of them had to be dropped from the study. The data analysis included thematic analysis and interaction analysis with support from software like NVivo and frameworks like VR codes, like were listed in our text, to identify emotional cues and patterns. The results were so interesting. So the researchers found that children often expressed fear indirectly through body language or subtle comments rather than directly stating they were afraid. The children's distress often focused more on the stinging pain after the injection rather than the needle stick itself. three main adult communication styles were identified. So the acknowledging, which validated the child's feelings and supported coping; ambiguous, which was unclear, rushed, or inconsistent responses; and disregarding ignored the child's emotions and pressured them into the process. So children coped better and showed more confidence when adults used acknowledging communication and gave them enough time and space to process the experience, which, as child life students and child life professionals, that is something that we already know, but it's really cool to see it really present in this study, because I feel like there's not a lot of studies that you can see it so explicitly shown. The conclusions are so important, so I went ahead and put them on this screen, but I'll read them as well. So the study concludes that how adults communicate with children during medical training has a big effect on children's emotional reactions and confidence. Fear is often not spoken, but shown through nonverbal signs. Giving children time, choices, and clear support helps them engage better. The author suggested that more than one training session may be needed, and that nurses should be trained to recognize and respond to emotional cues during procedures. So now we're kind of to my thoughts. So here are my thoughts on criticisms and strengths. So the strengths: the use of video allowed for real-time observation of emotional responses. The study gave rich, detailed descriptions of both child behavior and adult communication. The findings are practical and useful for real clinical settings. Criticism: the sample size was small and came from just one hospital, which limits how widely we can apply the findings. Some children had prior injection experience, which could affect how they responded. Two children were not very fazed from the situation, and those were the two who had prior experience. And there was no follow-up to see how children did at home after the session. Another criticism that I would have is that the video did allow us to have real-time observations to look back on, but because of the location of the camera, sometimes it was difficult to see the child's facial expressions, but the field notes that the observer made while in the room with the child were able to make up for the camera not being in the right place. My observations and what I learned: I thought that subtle signs of fear are often missed unless nurses are trained to look for them. So that's something that I learned. The study connects well with the child life field topics like patient-centered care, communication in nursing, and emotional safety. And it made me realize how important it is to validate children's emotions, not just explain their procedures. Now, I did already kind of have that in my mind, but because it really gave me a view of how these kids responded in the situations, I just thought it's something that I'll never forget. And then here's the reference for my study. This is why I struggled with saying all of the names. So I just said Sorensen and Associates, and it's called Children's Fear of Needle Injections: A Qualitative Study of Training Sessions for Children with Rheumatic Diseases Before Home Administration. So yeah, thank you guys so much for watching. I highly recommend looking up this study. It's really easy to understand. The discussion and conclusion area has a lot for us to look at, and it's just a really good study to have in your pocket as a child life specialist. So bye guys, see you later.